All right, and
Fucking
ready.
almost with your fucking phones.
Hey, whoa. I got to restart now.
Me?
Yeah.
And go. No.
No?
Yes, rolling. I think we have to clip the front first few.
We'll start again.
Welcome.
Start again or no?
Well, now we have to.
Start it over. Start it over, and I'll just cut the first. I'll cut that.
Okay, tell me when you're ready.
Go. Do it. And we're live.
Welcome back, everyone. Vitality Check Podcast. Oh. Doubling up.
Take 3.
Take 3. Do I have to say welcome back again?
Welcome again to the Vitality Check Podcast.
Oh, gosh.
Polished.
We are
Yeah.
good.
Yeah.
We are really good. Well, welcome back, everyone. To my right, I have Dr. Sean Landry. Doctor is questionable. J. Bone Turnbull,
Bone is questionable.
also questionable.
Very questionable.
And your host, me, Kevin Lockray.
Host.
So today, boys, well, number one, before we start, how are you?
I'm great. Yeah,
Everything
thanks for
good?
asking. Feel very relaxed on the couch. This different setup for us.
Yep.
It's actually quite
Super
quite nice.
casual.
'Cause the other chairs we have are nice too, but they're a little rigid.
Stiff.
Yeah, stiff.
Need to be broken.
This is
in.
very
Mhm.
yeah, very casual. I like it. Yeah. Listen, I'm great. What's
Maybe
not to be
this
great
is
about?
this is our new spot. Maybe
There you go.
Maybe.
We're about to
the staff can't come in here though.
Nope. True.
Mm,
As
this is why there's take 3.
take
going
3.
Nice. That's true.
We need to
We're
hang.
not going to
the,
name any names, but
No.
somebody.
We need to hang the or get the on-air light flashing.
Dude,
right?
we should get that light. That'd be
Yeah.
awesome.
On there one day.
on one day.
So-
Maybe let's get a porch first.
Yeah, fix
That's
the-
true.
Fix the deck first, and then
True.
and then the on-air light.
Okay, so topic today, boys. What is pain really? So we're going to be talking about pain. What does it represent? Obviously, people coming in here, that's what they're suffering from. We wanted to give a little bit of context, though, of well, why do we get pain? Is pain something that happens immediately? Is it something like we tell our patients quite frequently that it's the end of the line? Like the pain is the last thing to come out. So there's been a few things that you've probably ignored in the whole compensation game that have led you to then developing pain somewhere. So whether it's acute pain where you've just woken up and started having back pain or whatever pain you're suffering from, that is more of an acute thing. Whereas
Tears.
there obviously is some people suffering from chronic pain as well. So what are the differences? We're going to go through a little bit of the runaround of the lead up to pain, what can happen when it becomes chronic, and what are some solutions to get out of it. So, boys, why don't we start with maybe a bit of an explanation of, so why does pain come out in the first place? What is the purpose of that?
Yeah,
Well, pain. I can't see you, Sean, but I'll chime
go
in
for
quickly.
it. Yeah, I see it through the screen.
There you go.
Sounds
So
good.
pain's like essentially it's like a warning sign from your body saying that something is wrong. And Kev, like you're saying at the start there in your intro, which was fabulous, is
Thank you.
quite often, when people are not really aware of, how they're living and what they're doing day by day, is like you said, it's actually one of the last things to come out when there is something that's wrong. People aren't maybe always aware of their bodies and how they have lost, whether it's range of motion or functioning in certain areas, and those actually come out first. And pain is usually one of the later signals to arrive from our body. So essentially, pain is like, if you break it down, it's a C fiber, right? It's a nerve that sends impulses to your brain, to your spinal cord first, and to your brain, relaying messages that there's a problem. There's a source of discomfort or dis-ease in an area of your body. Or can be referred as well, I guess, but generally speaking, it's like that. Can be physical pain, chemical pain, many different sources of pain, and it's a warning system for your body that something needs to be addressed. And pain, especially if it turns in and lasts a little bit longer, is obviously there's some sort of dysfunction or something that's not in harmony within your body, that your body is essentially shouting out for and saying it needs to be addressed.
So maybe we can dive a little bit more, Sean, into the reasons why. So like, let's say for instance, like people come in all the time and they tell us like they have pain in a certain area, and it's not necessarily where the dysfunction is.
Yeah.
So can you explain why that's the case sometimes of maybe the viewpoint of like the body as an interconnected unit, you know, like why is it that there's certain areas that develop pain when what's really wrong with the person is elsewhere?
Yeah. So I guess yeah, pain is hard to understand for a lot of people because it can be very compensatory in nature, meaning that the area that you might be experiencing pain might actually be far from the origin or source of the pain. Now, again, pain can be a noxious stimulus. It can be wear and tear. There can be all sorts of different causes of the pain. I guess, yeah, it's such a complex topic. I guess, like, if we were looking at a biomechanical compensation, you can have wear and tear, and therefore, years of wear and tear in your knee, which eventually results in osteoarthritic changes,
Right.
that eventually lead to pain of that joint and or tissue surrounding, so swelling.
Right.
But not now. I guess the question you're saying is, it might have been something completely different that led to the compensation pattern, wear and tear, pain, right? So,
well, like,
and that could go anywhere, right?
Yeah.
Like we could say the knee is a lot. If we look different, exploratory models, it could be related to the digestive system. It could be years and years
of pure mechanics.
Could be pure biomechanics, right? Whereas there's a shift, a hip shift.
That's someone needs orthotics, and the ascending forces coming up. That's why people get orthotics.
Exactly.
The mechanics of the knee.
So ascending forces, descending forces. Essentially, what's happening over time is, for whatever reason, you are prematurely hinging or loading the medial compartment of the knee more so than the other knee and or right. So even there's only so many duty cycles that knee can handle before it says, like, hey, help me out here. I've taken a lot of the load. Actually, I look at it like a relationship. Let's say someone's doing more work than someone else.
Easy, be careful.
And eventually they go, hey, help me out here.
Yeah.
Like, I'm carrying. You're not doing anything.
Yeah.
You deadbeat.
Yeah.
You're
a scumbag.
I'm carrying. Look at my back.
Yeah.
Exhausted.
Spot on.
Yeah. So, but that's an example.
You made me think of an example when you said biomechanics in the knee, let's say, for instance. Like, so for those listening that, obviously they don't particularly understand the biomechanics, that the body actually moves. So we're constantly compensating for things that we do, for accidents that we have, for positionings we're in all the time, or for weaknesses we develop due to certain injuries we've had in the past, and
lifestyle, right?
Morphology, all these different things. So what can happen is, let's say, for instance, I had a friend. It makes me think of a friend that had a lateral knee pain, IT band tension, like down the lateral side of your leg. So, but it would only come after running a certain amount of kilometers.
Yeah.
And then, look at it, never been treated in his life. Look at his pelvis. His pelvis is completely crooked, and he's leaning onto his left leg. So imagine the wheels of your car not being aligned, and then you looking at your tires after a couple of years going, why are my left tires worn out more than my right tires?
Yeah.
Well, the reason is because of the alignment. So it's the same thing with the body. We can have these compensations that, if not detected, which most of us don't, we're not aware of that, because we just think the body just does what it does and it doesn't move.
And a lot of them are kind of, like, I would say, subclinical, right? They're actually, an analogy I use often is if you're driving in let's say your alignment's off, this is a really good one, and you're driving in a school zone where it's 30 kilometers an hour, right? Even in your car, you won't really notice that your alignment's off because you're driving pretty slow. But if you hop
130,
but if you hop on the highway and you start to push it, right? You start to
hit
jump
a couple kids, and for sure you're gonna feel it.
You're gonna feel it, right? No, but If you hop on the
Oh, that's
highway,
not where you're going.
no, and
Sorry.
you just went to Louis.
You're not doing 130
Louis.
in the school zone.
No,
You're doing
exactly. You're on the highway now.
Oh,
You're not in
okay.
the
Now
school.
we're on the highway.
We're
Jeez.
not in the school zone anymore,
Sorry.
Kev. So you hop on the highway and you start to speed up a bit. Guess what? You can feel the car, right? You can feel it shake
Mm.
per se, right?
Mm.
If something's off, and that's kind of life in general, right? If you're, let's say you're an athlete, this guy starts running, so he might have had this hip misalignment for a while.
Yep.
But day to day, walking around,
Yeah,
not too
fairly
bad.
sedentary.
Yeah.
You don't notice it.
You start running,
Yeah.
you start putting a lot of like repetitions and duty cycles, and increasing the gait over time, right?
Yep.
And now his body's going, oh, wait a second, I can't handle this added stress
Yeah.
and strain. So your body is going to look for weak links in the chain,
That's right.
right? Weak, I guess, based on different
Like
biomechanical
overloading.
principles. Yeah, they're going to overload it, and then the pain. And again, everyone's different. Someone might have a lower threshold. Someone might have a higher threshold. Someone might be able to, really, really put up with it, and their stimulus, their pain stimulus might be, pretty low, and someone's might be a lot higher, right?
Yeah.
But the
Oh,
most
yeah,
important
it's so
thing,
different between individuals for
Yeah.
sure. Yep.
anyways,
Well, you're
that's a
saying
great
how
example.
how some people are like, but they don't really notice differences before the pain comes out. But there are others there. Once you bring it up, like, oh yeah, well the reason maybe you're having it is because look how much you can rotate to your left versus your right, or how much you do this, and they're like,
I
now that
didn't
you say
notice
that,
yes.
I did notice that when
Mhm.
I checked my blind spot that I couldn't turn one way versus the other, and
Mm.
they start to see that my body was, because normally that's what our body does. It does. I mean, there's a book by Baral that says understanding the hidden messages of your body. So oftentimes it is speaking to us. In fact, all the time it's
All
speaking
the
to
time.
us. It's whether or not we're actually
Listening.
tuning in and listening.
Yeah.
Exactly.
Well, so like we said, these are warning signs of many things, and often not always mechanical. So obviously there is the mechanics. So if we go into the reasons, because we want to give you guys enough background and knowledge to understand, so
Probably the easiest
can
way to
listen
start
more.
is
Mechanics.
mechanics.
Yeah,
right?
for
Because
sure.
we can all understand the way you move through life.
Yeah.
Wear and tear, weak links in the chain. You can relate it to a car, right?
Yep.
Things breaking down.
Then we can get into obviously the psychosomatic. So like for sure, you're gonna have an impact of the way you're perceiving reality, the way that you're living, the emotions that you are looking at and or not looking at will actually have an impact on the structure of the body. So whether or not, and a lot of times this happens in office where we discuss these things and people start to understand that yes, I have been experiencing, I don't know, anger or frustration or whatever, and they start experiencing these types of discomforts in the body because it's been chronically a problem for them to be in that state. So there is this understanding that is super important, is to understand that it's not always just the nuts and bolts that are the causation of it, the way that you move, the sports you play. It's also the state that you're in on a regular basis that will dictate a bit of the how the body is always like a mirroring a little bit how we're experiencing life, right? So
100%. It's funny. I had two people in today, not to try to relate it to right away to today, but
say their names, please.
yeah. So one of them lives in no. So I had two actually. It's funny how this comes up. One came in as an emergency, and just has had a lot of stress recently, and kind of building up with some kind of deadlines. The stress is in a finite period. There's a date when this stress ends, but nevertheless a very stressful period. And they were sharing with me how it's crazy how the pain goes back to where I normally would have discomfort. So we talked about the memory of pain and the
Yeah.
limbic system and
Facilitation.
how it's like how there's like this memory of the strain and it goes back towards that area. So again, did nothing physically different in the day-to-day life, purely, and
Carrying
she said it
more.
herself, really my mental state is the only thing I can think of that brought it on and brought it to that spot.
Right.
And then another one and talking about actually maybe less pain but more sleep patterns and having some difficulties, which was abnormal for them. And literally shared the book, opened the book up to them, showing them the visceral clock and the
Yep.
emotions of the body between certain hours of the day, and went to the lung, which is between 3 and 5 a.m. and was kind of just, I thought this person would appreciate showing it, like seeing it as opposed to me just saying it, and literally talked about some of the different characteristics of people who have energetic issues with their emotions in the lung. And we were right over the first 6 or 7, and like stopped me and said, "Oh my gosh, like I could tick every one of those
Yeah,
boxes."
yeah.
So completely again, like mind frame, how they're living, and the physical symptoms, we'll call it, that is coming out in their day to day life. So
Yeah.
it's every day, all day is the stuff that we talk about things like this with
So
people.
that okay, that's perfect segue because that leads us into then comparing, okay, what's the difference between acute pain versus chronic pain, right?
Yep.
So like people that are having difficulty sleeping, quite often there can be an acute trauma that definitely does
Yeah.
that. Most often is an accumulation of stress that causes the body to be in a state where it's just not willing to go to bed because it thinks there's too much stuff going on.
Yeah. Yeah. There's being overwhelmed, right?
So how would you describe the difference between acute versus chronic pain?
Okay, chronic to me will there'll be I guess the ebbs and flow of life, so to speak. Your body will perceive pain, but there's a certain amount. I guess your body then says at one point, say, I got other shit I got to take care of. I'm gonna put you on the back burner, and I'm gonna down regulate how much priority I give this pain, but it's always there. So it ends up being like static and dysfunctional static in the background, right? You put it on the back burner because there's only a certain amount of energy you have to take care of all the other stuff you got to go on, right? So all your, physiological processes, getting the kids to work or getting the kids to school, performing at your job, right? Extracurriculars. So chronic pain can kind of like Jason said, you could sit on the back burner. It can be low grade for a bit. You can become, I use this often, quite functional in your dysfunction because we are amazing. The human being is amazing at compensating, but it'll always be on the back burner. And now your threshold is lower. Your capacity to buffer life is now lower. You have a hyper facilitated chronic pain pattern. So like it will flare up a lot more frequently based on life. So this woman, for example,
Mm-hmm.
carrying a lot at work, whatever profession, boom, pain pattern, right? Versus an acute inflammatory response could be, like you say, trauma. So you could have um, a whiplash, a compression injury, a sports injury, a slip and fall injury. Now again,
Even an emotional trauma.
an emotional trauma, right?
Mm-hmm.
Now, again, your body's ability to deal with that is directly proportional to how much you're carrying. So, like, you could have a chronic,
And what you do with it.
and what you do with it, right? So, I think it's for some, we've heard this example before. Why is it those guys doing the remember Dr. Aru used to say that, the guys that do the
Never heard of it.
the crash the derby, like the crash
Demolition derby.
demolition derby. Why do they have very few concussions and whiplashes, and yet they're just ramming each other all right because they're doing it for fun, and
There's no trauma wrapped around it.
right, they're actually
Intentionally hitting each other.
intentionally
Their
hitting
state.
each other.
Their
Their
state.
state. So we come back to your state, right?
Mm-hmm.
Versus someone that might walk on a slip on a sidewalk and then really mess themselves up.
Yep.
State of mind. What are they carrying? What else is going on in their lives?
Yep.
What have they been ignoring or putting on the back burner, right? So your threshold, and then your pain response is different, right? Because it could be, like you say, it might be someone's threshold, or it might be super hyper inflammatory because of all the other things they're carrying, and someone again who's living well, checks and balances, might bounce back super quickly, right?
Jay?
Yeah, I mean, I think Sean, I think you covered that really well. I would just, when I think of chronic pain, I mostly think there's a bit of a learned behavior to that. There's a chronic like neurological adaptation to whatever's been going on.
Mm-hmm.
And like Sean had said, I think I often will draw this little diagram of like what it takes to create pain in a body is we need to have like a certain impulse from a nerve, and it creates a wave. And that wave to elicit pain in our body has to be of a certain amplitude to bridge a gap to create that response in the body.
Yeah.
And this little bridge that has to go over, you can picture like almost like a ditch, if you will. Normally, when we're not in a chronic state, would be you have an impulse, it bridges it, it crosses, and then the ditch empties. But in chronic situations, that ditch and this is a hormonal issue and stuff that happens at that cellular
At that
level,
level, yeah.
it doesn't actually empty. And with time, that ditch remains stagnant, that there's always some in there.
So the flood happens.
So the flood happens, and the result of that is now you require a smaller stimulus to elicit the pain response.
Yeah.
And it becomes this, and that's what
Chronic
we do
loop,
as
yeah.
osteos and chiros and physios is we're trying to decrease neurological input. We're trying to restore and recreate that buffer. It's like that glass that's full of water and it can't hold anymore. Your buffer is gone. So that's my generalized thinking of what a chronic issue looks like. And acute, as Sean, is what you said, whether it's like you said, Kev, emotional or trauma. It makes me think more of like there's pain, there's inflammation, there's the short-term,
The early onset of symptoms.
short-term stuff that your body does to try to for safety, right?
Yeah.
It sends in the inflammation, it sends in the platelets and the white blood cells to stop the bleeding, and all these things that we have to do to heal properly. But that it's in a much shorter time frame, right? It was in a couple of weeks, let's say, as opposed to months and months afterwards.
So we could say that pain is like the alarm, right?
Mm-hmm.
Telling us something's wrong.
Yep.
Now, like you said, that fills up that gap,
Mm-hmm.
right? Or that glass, if we look at the analogy, we're filling up that glass. Now, if we decide not to empty that glass and not deal with what the problem is,
That's chronicity.
the glass gets full and then takes
stays full.
very little to overflow.
Yep.
So the idea is the emptying part, like you had mentioned. So what does that entail? Because emptying it might mean like, oh, I need to go get an adjustment because my body is in a state where it can't compensate anymore.
Yeah.
So my glass is too full.
Yeah.
Or I've suffered many traumas, emotional, psychological, belief system, whatever it is that I have not dealt with, filling that glass, and that also causing things to overflow and not to have that resiliency that I used to have when the glass was empty.
Yeah.
Super accurate.
So it actually comes down to that. It's like, how do you empty your glass?
Yeah.
And become more resilient.
Yeah.
Right. Sometimes we need. Yeah. I like what you're saying. The
Build back
resiliency
capacity.
part is great.
It's how do you build back capacity to
Deal with more
buffer life, right? How do you build back capacity to buffer life? Because that's it. Life is that glass, and the space that you have in that glass is your resiliency capacity.
And a lot of people are convinced, I think, avoiding is what, if I avoid these things, if
It'll
I
go
avoid
away.
that, it's going to go away.
Yeah.
That's never works.
I'll deal
That
with it
causes
later.
a chronic
We'll
problem.
deal with it later.
And
Yeah.
but that buffer, this is, I think, actually, this is really essential that we explain that capacity to buffer life, right, that's the symphony orchestra. So that's the mental, emotional, physical, biochemical stresses of life. So I think that's a really good point that you made, Kev, because it's like now the key is identifying low-hanging fruit. So you're in a state of pain. What do you do first? Now, it might be different it might be classic, right? It might be the classic, oh, shoot, this is an acute trauma. I address the tissues. I address, the motion, the mobility, right? I, decrease inflammation through movement, whatever. It might be low-hanging fruit. But it might be something deeper, right? There's some chronicity to it, it might be, oh, shoot, like you say, these repetitive patterns, these belief systems.
Well, I think, and like what we'll get into in another episode in the pain series is going to be where we maybe define a little bit more what even segments of the body represent, because then the whole language thing becomes even more specific.
Yeah.
So now we're looking at the generalization of like pain as being an alarm. Okay, well, that's great. I know there's something wrong, but what, if you really think about it, if you didn't fall, if you didn't do anything, well, why is it that I have discomfort?
Yeah.
It could be, I didn't take care of myself. I've never gotten treatment, perhaps, never got an alignment. Or I'm, there's something I'm not dealing with. And it could be very specific to the part of your body that you're actually suffering from. So those are some things we can get into on a later date, because I think today what's important that people take away from today is that, one, it's important to listen to their body.
Yeah.
Listen to those symptoms that are coming out. They're there for a reason. Like, don't ignore them. And we're all guilty of this, like of having discomfort, having this and enduring it and thinking like, well, it's not that bad. It's not that big of a deal. And then eventually then you end up having hip surgery.
Yeah, or you get your tooth pulled on
or you
Monday.
get your tooth pulled,
Um,
right? So
no, yeah.
we're
We're all
all
working
guilty
through
of
this.
this.
Yes,
Yeah.
I like that, and so I'll maybe we'll leave with this.
Yeah.
I think reframing how we see pain is important too. And this is a Paul Chek thing, but he calls it the pain teacher. So what can pain teach you,
Yeah.
right? I guess is the first part, and then it's like, okay, now that it's teaching you things, what are you willing to do about it in order to make changes? Because I joke, I sound like a broken record with people. Like last year I've said like, listen, it's telling you stuff. I can help, but you're your best doctor. It's like you've got to do some some deep thinking
Mm.
to be like, how am I living? How am I living that is contributing to how
Yeah.
I've ended up in this place,
Mm-hmm.
right?
Yeah.
So, and with honesty, with love, it's like looking in the mirror and being like, okay, I'm lying to myself. I should be doing this, but I'm not. I'm doing too much of that, right? So it's like going through the mental, the physical, the emotional, and and it's not a bad thing. So reframing, oh shit, I'm in pain. Most people, it's like, man, I'm here.
And I'm not, I don't even ask before
Yeah.
you ask. I'm not even doing the exercise yet. So
Yeah.
it's like, okay, so why aren't you doing the exercises?
Exactly.
Okay, you know that they're there to help, but you're
Yeah.
not doing them. So why are you not doing them?
Why?
Like,
Right.
what is holding you back from that kind of stuff?
There you go. Right. So
It
pain's
also makes me
Oh,
think.
right
Sorry,
there.
if I do another adjunct as far as pain controls, I know we wanted to maybe touch briefly on what can we do for people when they're not feeling well.
yeah.
It makes me think of when we talk a lot about this buffer and the bridging of the gap and stuff. Is, I mean, I'm sure you guys get it too. What do you think of the Dr. Home machine or the TENS machine?
Yeah.
And that's how I explained it to them. I said, listen, it has a use,
Yeah.
for sure has a use, right? So essentially, when you put on these little pads, they're essentially stimulating a larger diameter nerve than a pain nerve.
Yeah.
And the rule of physiology is that the larger the diameter of the nerve with myelination, travels or conducts faster than the smaller nerves.
Yeah.
So it bridges that gap first to get to the spinal cord to relay to your brain that this tingling feels pretty good and your pain's not there anymore.
Mm-hmm.
The downfall is that when you take that machine off,
Mm-hmm.
you're back to the same pain pattern again.
Yeah.
Right?
Unless you do something about what caused the
You're
pain
just
pattern, right?
Yeah,
So-
you're just giving that.
So-
You're just cheating the system a bit. You're like
Yeah.
kind of short circuiting. You're kind of bypassing it, right? And then it
Mm.
just comes back because you're not addressing really what is the root cause.
Yeah.
Dr. Ho is not a sponsor of the podcast.
Not anymore.
Just in case anyone.
Nothing against it. Like I said,
Yeah.
it's got a use.
It has a
It's got a
use,
use.
right?
I've
It's
got
funny,
many
yeah.
people who
Yeah.
have chronic pain that get relief
Swear
from it.
by
I would
it,
say no
exactly.
problem. Absolutely.
Sometimes, like you say,
You need some relief.
when it's super inflammatory, you're like, well, whatever works sometimes, right? Put
Yep.
whatever can help put out the fire with,
For sure.
being.
Yeah, I didn't mean that as a total negative. Just a why it works.
Semi-negative.
Semi-negative.
Semi-negative. Yeah.
Okay, so I think that's
That's a
think
good start.
Good
Pain
start,
is
guys.
such
We're
a
gonna
complex.
and we're gonna come back with some more insights on going a little deeper into pain, and that's it. So just remember, pain is your friend, actually telling you something. It's your body letting you know that there's something wrong. If you need some help, we're always here for you, and we look forward to talking to you guys next time as we go a little deeper with the pain. The pain topic. All right, guys.
Have a
So
great
have
week.
a great weekend.
Yeah, take care, everybody.
Ciao.